Hi guys, this is Dr. Laura Ritchie. I'm a certified women's health and functional nutrition coach and doctor of physical therapy, and I'm here on this Self-Care Sunday to talk to you all about tips on preparing for surgery. And some of you guys know that I have a hip scope coming up and was diagnosed with adult hip dysplasia. That is a congenital thing that I was born with and have been on a little bit of a hip journey related to that. And as I prepare, I just wanted to do a self-care Sunday on this because I think oftentimes people feel like the surgeon's going to do all the work and they're going to go in and fix it and we just don't need to do anything, and that's really not the case. There are so many things that we can do to empower ourselves and help optimize our surgical outcomes with healing, and I have so many tips and tricks for you. This is not my first rodeo. I've had a few surgeries, so I have learned a lot through experience on the way and done a lot of research in this area. I wrote and taught the course on preparing for surgery and nutrition to optimize surgical outcomes pre and post abdominal and pelvic surgery for the Integrative Women's Health Institute. So lots of fun with this. I have lots to share, you guys. Oh, thanks, Hillary. Thanks for joining. Yeah, it's so much to talk to you guys about. So first of all, I just want you guys to know, because oftentimes people feel like when they're having surgery that it's a failure. They feel like that they failed and they're having to do surgery. And I want you to know that it's not a failure, and attitude's really important. And you have to shift your mindset into thinking about healing through surgery, that this is not a failure. And you want to have a really great surgical team. You want to find the right surgeon. You want to have peace about this. And we talked a little bit about this in last week's Self-Care Sunday, all about becoming your own health advocate. So check that out, and I share a little bit more about my personal story and everything. But finding the right surgeon, having peace about everything is so important. So that's tip number one, is if you don't have peace about the surgery, don't do it. Hold off, wait, get a second opinion. When you have the right team, when you found that right person and you feel really confident, then you want to get a copy of your post-op protocol. And this is really important, especially if you're doing some kind of orthopedic surgery. You need to have that on hand. I want you guys to read it. You want to understand what's going to happen with the surgery, what's going to be expected of you after the surgery, and also talk to your surgeon about a temporary handicap permit. This is something that you can get, especially if you're going to be on crutches or using a cane or some kind of assistive device. This is really important, guys, and this will really help you, especially when you're using those assistive devices and trying to get in and out of places. Having a temporary handicap permit is really important. The paperwork's really easy, at least in the state of Texas. You just go to the Texas Department of Motor Vehicles online. You can print off the form, you can send it to your healthcare team, and they just fill out a piece, and you fill out a piece, and then you go. And I think it's around $5 per permit, and we got two, one to have in my car and one to have in my husband's car, because for a couple of weeks you're going to be needing somebody else to drive you around for a little while, and this can really be a game changer. So it's something that not a lot of people may think about, but have that conversation with your surgeon about getting a temporary handicap permit, because it's really important, guys, and it will be helpful, because when you're using crutches, the energy expenditure related to that is a lot. It's a lot of work. Plus you're healing. So things that we can do to simplify that is going to be so great and so helpful with this. You also want to ask for a script for physical therapy and work on finding the right physical therapist for you and get to know them, because you're going to be spending a lot of time with this person as you're recovering. And I would even recommend setting up a time to see your physical therapist before surgery and get evaluated, and have them go through some exercises that you can do, some prehab, some rehab that you can do before the surgery to work on strengthening. And guys, there's a lot of research that shows that that can actually optimize your outcomes by strengthening and doing that ahead of time. So that's really amazing to have that on hand. And you just want them to have your post-op protocols, know what's going on, feel really confident in your physical therapist. Make sure they understand your surgery and what's expected, and schedule your appointments out, because they could get booked up, especially if you're finding a physical therapist that specializes in something, and you just want to get that on the books so that you can just transition right from your surgery into physical therapy if that's appropriate. Talk to your surgeon. My surgeon wants me to start PT post-op day 1. So I've already scheduled that appointment, have that all ready to go and lined up. The more that you can do ahead of time, the easier that this is going to be for you. So just plan ahead with that. Find an amazing physical therapist to help you. You also want to organize everything in a binder for your caretakers. We want to simplify this, guys. So I have a little binder here that I've already started organizing, and it has here's the little form for the temporary handicap permit, but it's got this, it's got my post-op protocols in here, it's got my script for physical therapy, my insurance information, my cards for my surgeon and my physical therapist. All of their contact information is in here because after surgery, you may not feel so great, you may be on pain medication and things, and we want to really simplify this for our caregivers so that everything's in one spot. The durable medical equipment if needed, all of that information is here so that your family has it and they know if you need medications and what time to give that, and we just want to simplify things. So having that on hand for your caregivers is really handy. Just organize that binder, and so it has all of that information in a one-stop shop, which can really, really simplify things and make it really, really helpful. You want to start gathering all of your medical equipment that you're going to need, and check with people. Check and see if you can borrow things from friends or family. You could look on Craigslist or Facebook Marketplace or Goodwill. For example, for a hip surgery, things like a raised toilet seat and shower chairs or transfer benches can be really helpful. Grabbers. I actually got a ton of grabbers, little reachers from the Dollar Tree, and I put them in every room, and that was handy. A walker with a little tray table so that you can carry stuff around with you, or even a small little backpack purse or something, because if you're on crutches, your hands are going to be full. So thinking about that, having tools that you can use to keep your phone on you, or water, something, a little backpack, something to carry all that around can be really helpful. And you want to look at those places like Goodwill or some of those other places, because this stuff can be really expensive. So if you can borrow it from somebody, that is always a great option. And you just want to have that stuff on hand. You want to start looking and even start practicing with it, guys. Start practicing using your crutches. If you don't know how to do that, get with your physical therapist ahead of time and they can teach you how to use that and do crutch training with you so that you know what to expect. For example, I am going to be partial weight bearing 20 pounds. So I actually got a scale out and put my leg on that scale so I know exactly what 20 pounds feels like going through your body. And this is really important, guys, because it's not a lot and a lot of people will overdo it. So again, we're going to prepare. We're going to practice. This is like the Olympics, guys, and you're going to go into this surgery feeling confident. And you're like, I know how to use my crutches. I'm prepared. I've got all this down. So this is really awesome. Oh, so Hillary says her parents built a main level master suite for her grandmother. Oh, how wonderful. When she visits, and yep, grab bars in the bathroom. Yes. Throughout the home, it does. It makes a big difference. So we are preparing your home for a healing surgical environment for you. And we're looking at all these different areas. Get rid of those little rugs. Those are just, walkers, crutches, all of those things like to get caught in the little rugs. Look for minimizing clutter throughout the area. We want to simplify right now, and we want to really make that home a healing environment for you with surgery. So all of that's really important, and just getting that medical equipment ahead of time and having that is really, really important with that. We want to do some mind-body preparation as well, because when you feel calmer before surgery, this can help with reducing pain after surgery. You can use less pain medication because you're feeling better. You can strengthen the immune system because we're not feeling stressed out, and it can help you recover faster. So these mind-body techniques are really, really important. So talking about meditation, talking about preparing that mind, body, soul for this journey that you're going on, this healing journey. One of my favorite books is Prepare for Surgery, Heal Faster. This is by Peggy Huddleston, and I actually had the pleasure for the course that I taught of interviewing her, and she was just an amazing lady. This book also comes with an audio CD, which I have already put on my iPod so I can listen to it. And you just start listening to it before you go to bed or whenever you can fit that into your schedule. But it's amazing, guys. And I would even recommend talking to your surgeon or your anesthesiologist about listening to that during the surgery. You're actually in a hypnotic state. You know, you're asleep, but your brain is still active. And so if you can have those things on hand, this is another tool. Sometimes they don't always let you do this. For some of my surgeries, they didn't. But talk to them and see if they will let you listen to this, have that on hand, because you're susceptible to that. Your brain is still awake. And so why not use it to really relax you and stay in that meditative state, stay in that healing state while you're having the surgery. This is kind of cool. Use things to your advantage, right? So talk to them. This is a really quick read. There's many other great tips in here. I could do a whole Facebook Live just on this, but get the book. It's amazing. It's on Amazon. Get the audio CD that comes with it, and it can really help you to work on that mind-body preparation, because visualization, just like Olympic athletes do that, she talks about this, guys, and it makes a difference. You visualize yourself feeling really great after surgery. You visualize yourself waking up in recovery, feeling good, you're calm. You visualize the healing in that area. It's so important. Oh, that would be a good question. Yeah, I wonder if they would let you diffuse calming essential oils. I'm not sure if they would let you diffuse in the OR. They have some pretty strict rules about some of that, but guys, when I'm in pre-op, I'm smelling my oils. I've got my oils out. I am smelling them. I am using those to my advantage for sure. And that's a great way. Yeah, you put on your calming oils. You want to get in that frame of mind. And what I do is I listen to Eye of the Tiger or some kind of pump up music before, like the morning of the surgery. I'm like, yeah, we're going to do this. I'm feeling really good. So whatever music that pumps you up, but music is a really great thing that elevates and lifts mood. Using your essential oils for emotional support can be really great. And we'll talk a little bit more about that too. But you got to get into that frame of mind. And it worries me when people talk about, because I'm on some support groups, they say, you know, they'll take a selfie or something and be like, okay, I'm about to have surgery and I'm scared out of my mind. No. That is not the feeling that we're going for before you're having surgery. We want to feel confident. We want to feel ready. We want to feel like, yes, I'm healing. I'm getting this done. All of these things. So preparing ahead of time, working on that meditation piece, working on all these things that I'm talking about is going to help you do that. And you're going to feel completely prepared and ready to face this and ready for this healing journey. That's the goal that we're after with this. So things to think about. Relaxation is so important. It strengthens your immune system. Guys, your body cannot heal in a stressed out state. It just can't. When you reduce stress, it actually helps to increase the number of T cells, which help with your immune system. But if you're stressed out all the time, that number of T cells is going to go down. So things to think about. Really work on your stress. Really work on that mind-body technique, whatever that may be. That may be deep breathing. I love the surgery meditations. There's several of them if you look online, but something like that to help you with stress is going to be really key with that. Nutrition. You guys knew I was going to talk about nutrition, right? It's so important for your health and healing. And you really want to go on an anti-inflammatory diet. What does this mean? Well, it means we take out the processed foods. The top inflammatory foods are gluten, dairy, sugar, soy, corn, peanuts, and eggs. They're inflammatory, guys. And even when we talk about surgery, I'm going to add alcohol and caffeine to that list. Alcohol is really dehydrating. It can stress the liver. Caffeine also taxes the liver. It breaks down the capillary walls. It can encourage more bleeding. It's very hard on the adrenal glands. Alcohol basically turns into sugar in the body, and caffeine can also weaken that lining of the intestine when we're talking about gut health. So we want to reduce those. We want to take them out, ideally several weeks before surgery and then after surgery, so that we just have a really anti-inflammatory diet and can optimize our surgical outcomes with nutrition and helping our body heal and giving it the nourishment for our cells that it needs to really optimize that. So all really important things to start thinking about, and you can start with prepping your food. You could set up a meal page where a website or something like Meal Train. Meal Train's a really awesome one, and you can reach out to your friends or family and maybe they can help to prepare some meals for you after surgery and bring those over. You can even schedule it out. You could get a collection of healthy recipes, and this is a great opportunity for your friends and family to learn some healthy recipes and get in the kitchen and have fun with this and make some things for you. And you can have those on hand and they can bring stuff to you. This is a time where you can get in the kitchen and you can make some meals ahead of time. So you can make some homemade bone broths, which are really high in collagen and amino acids, which are great to help you heal. Some homemade soups. All of these things are really important. And when you're healing, if you can do more soups and smoothies and things that are easier to digest on your system and take off the load of your digestive system so your body doesn't have to work so hard to break down all of that food and it can just spend its time healing. Those are going to be really ideal. So maybe that means having a little meeting with your caregivers and teaching them how to make a green smoothie, or showing them how to make some soup, or having that on hand and you just show them, hey, this is where everything is in the freezer, and then you're good to go. But we want to simplify as much as possible with this and have those healthy foods on hand to support you with your healing, with everything that's going on. Stocking up on healthy snacks and having those ready to go. Maybe that means finding some restaurants in your area that have a gluten-free menu or a vegan menu or something that is really handy, and putting those little handouts in your magical binder for your healthcare givers so they could call something in and get food for you that way. Whatever you need to do to kind of prepare everybody. But your food is really, really important, and we need those building blocks for your body to heal. Very, very important with this. So think about that, plan ahead for that. And you also want to get support. This is a time for receiving. And this is hard for a lot of us. And it was really hard for me after the PAOs, after the periacetabular osteotomies, when my pelvis was broken in 4 places. I had a broken pelvis, guys. I needed help to get to the bathroom, to shower, to do everything. And especially as women, I think we often feel like we have to give, and we have a harder time receiving. And it can be challenging for us to receive, to ask and receive help without being able to reciprocate that right away. So just sit with that. Things may come up. Surgery can feel a little bit like a vulnerable time when maybe you lose your independence for a little while and you need help to do things. And guys, that's okay. This is a time for healing. This is a time for receiving, and take that in and let people help you right now. And when you're better, when you're healed, you can pay that forward. But it's just important to really build that web of support and have people, have childcare available, have family members that are available. Overestimate the amount of support that you think you will need. That's a quote from my mentor, Jessica Drummond, that I love so much. And it is so true. So plan for that. Build your team of people that are going to help you and have backups and all of that. Plan ahead for traveling to physical therapy, for traveling to follow-up appointments and things. Just scaffold yourself so that you have that team of people that can help and heal you with everything going on. We talked a little bit about creating a healing environment at home, and we want to remove the clutter and the rugs, maybe put some night lights in the bathroom in case you have to get up in the middle of the night to kind of help you. That can be a little tricky with crutches sometimes. You want really comfortable clothes, guys. Things that you can move around in, that can accommodate for a little bit of post-op swelling that you may have. Maybe you have your favorite blanket. And guys, getting rid of clutter also means negative people. This is not the time to have those energy suckers around you when you are healing. This is a time to have really positive people around you, people that love you, people that are going to lift you up. Maybe not the negative Nellies right now, so just create some distance with that if at all possible. And maybe even a recliner, something, a comfy chair, prepare for that. We just want to think comfort and healing, and whatever that looks like to you is really important. And maybe some soothing essential oils in there. All these things to really support yourself. Maybe you get some books that you love. Maybe you get your favorite movies out, but all of this can be so, so helpful. Let's talk supplements. You want a really great multivitamin. You want to increase your vitamin C to really support your body. Bromelain could be a really nice thing to add in to help. A really good probiotic. I used doTERRA's probiotic because it is coated to really get in there with your GI system. This is a little hard to see, but it's PB Assist is what I use with that. Something that's going to get into the gut, something that has many different strains in there could all be really good. A good multi-mineral, because you want to have things like zinc and magnesium and calcium and selenium on hand. These are really, really important to have those structures to support your body. Have these things to help with healing. Really, really important. One of my favorite homeopathics is Arnica. And I don't know if you guys can see that. It's a little hard with the lighting, but Arnica is something that you can get at the health food store. It's really great for helping with any type of swelling, bruising to just support you in that way. If we can reduce swelling, we can reduce pain. So Arnica is a nice one. They're little tablets. You just put a couple under your tongue a couple times throughout the day. Amazing, amazing, amazing. I also like Rescue Remedy. This is another nice one to kind of have on hand. You can get it at the health food store, and it's just a nice one. It's great for any type of trauma. And surgery can be a trauma, made physically on the body and also emotionally. So you just put a couple drops under your tongue, and this is a great one too, to just support you, help you during this time is really great. Know that just the surgery itself is probably going to cause your blood sugar to spike a little bit. Just that, because when we think about stress and we think about like running away from the tiger, like figuratively, like if we're feeling stressed out, the body doesn't know the difference and it feels like it's running away from a tiger. Well, in surgery, the tiger bit you. Like we got bit. We had something going on that the body has to heal from. So staying really lower glycemic is another tip. I would avoid a lot of fruit and stick with lower glycemic fruits like green apples, pears, and berries. Take out the sugar, guys. It's just so inflammatory and it's going to inhibit with your healing. But those are good tips too, because your blood sugar is probably going to spike and be a little bit higher for a period of time after the surgery, and that's normal as your body's healing with that. Hydration. Hydration is so important. It's a gentle form of cleansing for your body. Ideally, you want to consume at room temperature just so your body doesn't have to work quite as hard. Take some of the pressure off, some of the challenge off of the body. And keep a glass or stainless steel container near you and just sip throughout the day. Hydration is so important. And there's even been some research that shows that hydration status affects the inflammatory signaling at the genetic level. So this can help with inflammation. This can help with post-op constipation or all of those things that may be going on. Stay hydrated. It's very important. Sleep. Oh my goodness, guys. Sleep, so important. This reboots your nervous system. This allows your body to detoxify as well, and it allows the muscles and joints to mend, to heal. We're talking cellular rejuvenation. It boosts your physical stamina. So important after surgery to sleep as much as possible. Sleep as much as you can. This can be tricky to get in comfortable positions or things. You could use some lavender essential oil on the bottom of your feet, or diffuse lavender, or maybe even take a drop of lavender internally if the oils you're using are safe for internal use, to support you in this way. But sleep is so important, guys. So really optimize that. This is when your body heals. And sleep before surgery. Start optimizing and banking that in now. This is so important. We want to stock up reserves. It's essential, guys. So essential. So start to think about that. Look into that. Schedule and make time for your sleep. If you get nauseous feelings after surgery, kind of that post-op nausea, some things like that, peppermint tea, ginger tea can be helpful with that, but I love essential oils because they are 50 to 70 times more potent than herbs, so you're getting a much bigger bang for your buck. So something like a bottle of peppermint could be great, and you could open it up, you could inhale it, you could diffuse it, you could put a drop in water and take it internally, or ginger is another go-to that I really like. You could use some ginger oil, and this would be a nice one too. You could put a little bit behind your ear, or smell it, or put a drop in your ginger tea, but we're talking about big guns here. Very powerful. I think 1 drop of peppermint essential oil is similar to around, I think 23 or 25 cups of peppermint tea. Powerful. So if you're feeling a little nauseous, use your essential oils, use those things to help support you. Can be a game changer. Put them in your diffuser, lots of different ways to take them. You could just apply right over your tummy. You could put a little peppermint on that area, or DigestZen, which is the digestive blend, but use those things to support you. And last but not least, we're going to talk about constipation, because that's a real thing. And those of you guys that have had surgery know the struggle is real after surgery, and can be hard and can be challenging, because a lot of those pain medications and things, well, they can back us up, and that can be an issue. So Smooth Move Tea by Traditional Medicinals is a really nice one. That's great to use. It can be very helpful with this. Increasing your magnesium. You can actually increase magnesium to bowel tolerance. So basically to when you get loose stool or diarrhea, and then you want to back off because we don't want to cause dehydration, but that can be something to do. Increasing your vitamin C. I talked about that earlier as well, but when you find that sweet spot for the vitamin C, you can get loose stool, so that can be something to help as well. Back off a little bit, find the right dose for you. Movement, this can be challenging, guys, especially after orthopedic surgery, but even just getting up and doing what you can, walking around with crutches or a walker or something can be really important. And laughter, believe it or not, laughter actually has a massaging effect on your intestines, and it can help to support your digestion, and it's the best medicine, right? So maybe watch a funny video or YouTube video or something, but if you can laugh throughout this journey, it can really help, and it can even help with that constipation. So those are just some tips and tricks to optimize your surgical outcome. Guys, there's so much that we can do. There's so much that we are in control of, like what we eat, and if we're sleeping, and if we're staying hydrated, and if we're managing our stress, and all of these things are so important, and they can have a big effect on your surgical outcome, on how you do. And attitude, your frame of mind, so important. Believe in your own healing, visualize your healing, so important with everything going on. I hope you found this helpful. I'm actually going to do a class just diving much deeper into essential oils to support you before and after surgery. It's going to be a virtual class on December, I believe 26th, the day after Christmas, guys, because I have a surgery coming up after, so I wanted to get that in. And that's going to be in our education, essential oil education group. You can find more about it on my health coaching page. If you just click on events, and you'll see it there, and all you do is click the link and it'll take you right in there. We'll add you to the group and you can watch it, and the replay will be up for 2 weeks, so you can watch it at any time with that and just check it out. If you want to dive deeper in this, let me know. This is something that I coach my private health coaching clients on. We're just skimming the surface. Like I said, guys, I think that the class that I taught was it was a lot. It was like maybe 5-6 hours, something like that. Maybe less, I'm trying to remember, but it was 4 different modules. And so maybe around 4 or 5 hours, but it was a lot. And we're just talking basics here, basics with everything going on. But if you need more help in this area, let me know, reach out to me. Nutrition pre and post surgery has kind of become a niche for me that I work with my private health coaching clients on, and I would love to support you with that. Until I have my surgery, and then I'll take a little break for my own health and healing, and then I'll be back doing what I love to do, educate and support people, and just empower people to really take back and reclaim their health and their lives, which is one of the things that I love to do. So reach out to me. And oh, Bonnie, I'm so glad that you found that this was helpful. Yes, Hillary, we're going rock climbing. It's one of the things that I'm visualizing and doing when I get all better. So important. Yes, healing vibes. We are having healthy, happy hips in the new year. It's going to be a hippie new year coming to you. And Tina, the name of the book, it is Prepare for Surgery, Heal Faster. And thank you for asking that, because I have a couple other resources that I forgot. So Prepare for Surgery, Heal Faster by Peggy Huddleston. If you like to nerd out, geek out, another really good book for you is this Recover Quickly from Surgery. It's another great book, lots of great protocols and things in here. Very, very nice. Oh, Bonnie, thank you. Oh, that is so sweet. Thank you so much. And this is another book, The Patient's Checklist. Very interesting, very good information, things to kind of think of and have on hand. And then there's also the Rapid Recovery Handbook. I have so many good books for you here, guys. But these are all things that I've read, things that I've dived deep into, looking at the research for things that can help to really optimize our surgical outcomes. And I'm doing a whole class just on essential oils for this, guys, because there's so many things. There is power in plants and in natural remedies and things, just so many things that can support us in so many ways. So I'm excited. I can't wait to share more with you guys about this. I wish you, if you're watching this, I wish you the best of luck if you are going into surgery, sending you lots of love and light and healing vibes, and believe in yourself and your own healing. You've got this. And you guys have a great rest of your week. I love these self-care Sundays. I feel like we get to connect and I get to reach out to you guys, and it's just so much fun. It's just such a pleasure for me. So if you'd like more information, I actually have a top 10 of my favorite surgical tips, and it's on my website, which is lauraritchie.com. www.vpweb.com, or I'll post a link, or actually if you go to my Facebook coaching page and you just click sign up, it will take you right to that. And I do it all by hand. I'm a one-woman show, but when I get to your email, I can email you that PDF and you can have it. And it just has more tips. It's got a recipe for homemade bone broth. It talks more in depth about some of the things we mentioned too. So if you'd like a little PDF and a little guide, check that out. And I just wish you guys all the best, sending you lots of light and love, and have a great rest of your Sunday. I'll talk to you guys later. Bye.